everyone, welcome back to my channel. It's Effie. Today I have Hannah from Reactiv, which is a virtual occupational therapy clinic. And Hannah, I want you to kind of share a little bit about your journey as an occupational therapist for the past 5 years. What led you to work in a virtual setting rather than outpatient setting? And tell us a little bit about Reactiv and how people with arthritis can benefit from it.
I'm an occupational therapist, and then I'm also the head of clinical experience at Reactiv. And I've been an OT for almost 5 years now. And kind of early on in my career, I did work at an outpatient facility. I worked there for almost 4 years. I just kind of knew that there was more benefit to just the traditional outpatient clinic setting, and that there was this gap of patients that were just kind of missing care, or that there was a way that we could use technology to kind of bridge the care. And I just really felt that there was this kind of gap between like the care that people needed and then the care that you're able to provide in an outpatient setting. I don't know how familiar like you or everyone is with the outpatient setting, but it's a very fast-paced environment, and there's a lot of patients that come in, and there's, as a therapist working in that environment, there's like a lot of moving parts and stuff. So I always kind of knew that there's a better way to treat patients, and I was really always interested in this like health tech intersection. And so a couple of years ago, I took a course in what's called user experience design. And I was really kind of interested in how we can really kind of leverage technology to, again, just like help patients. That's just really kind of like piqued my interest of getting involved in technology or health technology. And from there, I started working with Reactiv actually about a year ago. So like you mentioned, Reactiv is a virtual clinic. We connect you with an occupational therapist, and we get you set up on different games that are like interactive based on your experiences, based on your symptoms. We're there to support you like one-on-one. There's this like chat feature that you can come in, you can use, ask questions, like very detailed questions about like what's going on in your life and like what's personally affecting you, or like what specific questions you have. So it's a lot more like in detail, and it's really a lot more like you really just kind of focus on what's important to you, as opposed to working in or going to an outpatient clinic where it's kind of a lot more generalized care.
I've been doing occupational therapy in the outpatient setting this whole time. You guys reached out to me to test this, and I was a little hesitant at first, I'm not going to lie, because I've never done this before. I've always worked with the same occupational therapist. She's now retired, actually 2 months ago. So it's pretty sad for me, because I'm like, oh my gosh, who am I going to see now? Because she's helped me so much with like splinting. But you're right, like there is so much that you can do in the outpatient setting, and it is fast paced. But I noticed that when you're in the hospital setting versus like a private clinic, that change of pace sort of is different, if that makes sense. And you probably know that too. In the hospital, they kind of try to push you out faster, or they're like more like, next person, you can leave now. And then in the more of like a private setting, they're take their time with you a little bit. And that's kind of what I had experienced. And so my occupational therapist really was that person for me, where she just was there for everything, even would mail me splints during the pandemic if I didn't want to go into the office, stuff like that. So I wasn't really sure how I would benefit from the virtual, occupational therapy that Reactiv offers, but I have tested it out, and I have to say, I love it. It's really fun. And yes, of course, I think like people who do try this out, they are not going to be able to do certain things based on maybe their lack of mobility, pain levels, inflammation. And so that's kind of why I was not sure if I should try it, because I have pretty extensive damage in my hands, and people watching or listening, like that damage was more like progressive over time, over like 17 years. It wasn't necessarily something that just like came out of nowhere, even though it did. So like my damage has been like probably occurring since 5 years before I got diagnosed, if that makes sense for a lot of people watching, but it does. But with this, I just want to ask, how did it all really start? Like, how did you guys come to find that this may be like the best thing for people with arthritis?
Yeah. You brought up like a lot of really good points. So yeah, I'll start with how we kind of started. So Arthur, who is our CEO, he had a couple of ACL tears and knee surgeries in his 20s. And throughout that course of time, he had to do like a bunch of outpatient rehab. And then he also just like personally liked playing games. And when he was going through that rehab process, he really kind of felt like it was pretty boring, pretty monotonous, and like there was no incentive to really do the exercises. So we actually started in VR, like virtual reality, like headsets, and we brought the games that we have in the app to outpatient clinics. And so that's how we started getting patients in. And it was mostly like wrist fracture patients, mostly wrist fracture patients. And then that just got really hard to scale because that was like when COVID was starting, and it's a hardware, they have to like an individual headset. So it was just like, it's hard to get that to people. So that's when we pivoted to a mobile clinic and then made it fully virtual mobile clinic. So now all of the experiences are done only from your phone. And then so we opened the virtual clinic about I would say probably September, I think. And then so in that course of time, we saw about 100 patients, or we've seen a little bit over 100 now. And kind of in that process of me treating these patients, the patients that really stuck out to me that really benefited, really grateful, and it was like really a source of something that they needed, just like in terms of education, in terms of support, or there's just this lack of like support in the medical community for like long-term chronic conditions. And a lot of those patients were arthritis, a lot of them were rheumatoid arthritis, and others were like CMC joint arthritis, like pain in the base of your thumb. And a lot of those patients get really overlooked in kind of the healthcare world and the medical community, because it's like, oh, you have this diagnosis, and then the patient just kind of leaves and they're like, okay, and now what? Or you do get to go to an outpatient facility, an outpatient therapist, and you get to work with them, but it's not for forever because, you have insurance deadlines or insurance guidelines that only allows you like X amount of visits, say 6 visits or 10 visits, but like that lasts 1 or 2 months. But then as soon as you leave that, you may have a new issue that arises. You may not get to ask any of the questions that you needed to ask, or you just didn't think about it, or like it didn't happen. Or there's a lot of times where things happen over the course of the week. And if you're only going, say, once a week to the clinic, or even twice a week, there could be something that happened on Saturday. And in your head, you're like, okay, I should remember to tell my therapist about this on Tuesday, like that my hand was bothering me when I was doing whatever activity. But then you forget, like, because then you go into the clinic and the therapist has something else in mind for you or whatever. And then you just don't really get a lot of those questions answered. So even if after you are done with those visits, sometimes you don't have anyone to turn to. And you might not have like another doctor's appointment for like 6 more months that you can ask the questions. Those type of appointments don't always lead to like open-ended questions or discussion where you actually have time to sit down and ask questions to a healthcare provider or a medical professional.
Yeah, and I really like how you guys decided to go the mobile route. And I think that was for the best, probably, because this is genius. I think it's a big trailblazing like technology and a way to connect with patients that you guys are doing. And when I tested this out, I was like, I wish I had this in the beginning years of my diagnosis, when I was able to use my hands a little bit more. I'm still able to, but with like, there's 3 games, right? And so there's ones that you can do for opening and closing your hand, and then like pinching, and then moving your wrist back and forth. So 17 years ago, I was able to use my wrists more. Right now, I can't play the wrist game, but I was able to do the other 2 games. And just playing this game the other day, I was like, I wish I had this, because it's so nice. It's like a stress reliever too. It's like fun to play the game and you're actually working your hands out at the same time. Because I remember when I was going to occupational therapy, they would just print out the workouts for you. And then you would just have to stare at them, read them, and like memorize them and go about your day doing them. And a lot of people who have gone through occupational therapy and physical therapy, that oftentimes you leave your, therapy appointment and you're on your own, and then things start to slowly regress and get worse again, and then you have to go back. And like you said, you brought up a good point that insurances don't always cover the amount needed, especially if you live with a pre-existing condition. And there's a lot of gray area. I discussed this in a recent video with step therapy, prior authorization, and the amount of, black and white red tape that insurances like to put on patients. We only get approved for maybe 6 times, 10 times. And that's totally different, because if someone goes in for like a sprained wrist, versus if someone is living with an inflammatory form of arthritis. Those are two different treatment methods. And so chronic illness is chronic. And so we have to keep stopping therapy, going back. And so I felt like this was a really good thing that you guys came up with to leverage that in between for people.
Like you always have access to the games, like the games that you mentioned. They said there's 3. We're also kind of expanding towards the shoulder and then also the hip and knee. So it'll be eventually more full body. But yeah, so then you would always have access to those, because there are periods of time, especially like you mentioned, like dealing with a chronic disease, that sometimes you need to do those exercises every day to help with stiffness, that hand moving. But there may be other periods of time where like you're in too much of an inflammatory phase where you can't really play those games, or maybe you can only do it for like a minute or 2 or whatever the time is. And so it kind of allows you that flexibility. So it's not like super rigid, like you have to do this every day, because we know that, you know, every patient is different. And like some of the games aren't appropriate, like you said, for all the patients, but there's different ways that we can make it easier or harder. Like we have one game called the bubble shooter that you, like you alluded to, that you move your hand, open and close it, and then it's like just a wrist movement. But you don't have to have a full, we can change the difficulty level. So you don't have to make like a full tight fist, because some people can't make like a full fist this way. It could really just be like a movement, like not even this full fist. But that for some people is beneficial because it helps get them moving. It helps them kind of take their mind off it. Like you said, you know, like you're playing a game, and the games are pretty fun. Like, yeah, I might be a little biased, but
I'm not biased. I'm not biased. I tried it out, and I would have to say with the bubble shooter game, I probably will have to adjust my difficulty level, because when I was testing it out, I had told you even too, I was flaring in my hand. I'm like, I don't think I can do this today, but I did it the other day and it was pretty fun. So I'm not just saying that. I think it's like, it just really allowed me to kind of just zone out for a moment and do something good for my body at the same time. And it's good to point out that this isn't only for people with arthritis, like inflammatory arthritis. It's for general wear and tear arthritis, or even people who've had injuries. So you guys encompass like a wide range of conditions that you treat virtually.
Yeah, our main focus is like joint pain. So anyone with pain in their hands, we're mostly on the hands right now, but like I said, we're expanding to the other parts of the body. So hand, wrist, shoulder, and hip and knee. Those aren't available yet, but in the hopefully like near future. But yeah, right now, like anyone with like joint pain, a lot, like I said, that like CMC arthritis, of people who just, or maybe you don't even know that you have arthritis, or, you know, a condition, and you just kind of feel hand pain when you are like lifting a coffee mug, or when you are grabbing a gallon of milk, or when you're picking up your child or something, you're just kind of like feeling that it doesn't feel great, doesn't feel right. That's another like great type of population to kind of get started in it, because it can just teach you ways to, you know, move your hand correctly, move your hand like in the healthy movements, as opposed to doing movements that are going to be possibly like adverse for you.
Yeah. And so I have the app up here on my phone, and I'll show this, you know, in another segment here of this video, but you basically download it either on Google Play or iTunes on your phone. And they have a quick dash questionnaire here, and you basically assess your functional abilities. And then the finish onboarding, that's just another set of questions that you probably would fill out even in the outpatient setting, just to get to know you, right? Yeah. And then like you have said, the bubble shooter game focuses on the elbow, wrist, finger flexibility. Candy match is wrist flexibility. And then the block puzzle is finger flexibility. And that's where you pinch. Yeah. I'm going to butcher this, but it's called
Goineon. Wow, now I can't say it. Goniometer. That's how you go.
It's too early here. Yeah. That measures range of motion. And that's what I wanted to kind of lean into right now before I ask you another question about insurance coverages and how all that works out. And because people want to know probably, do I need insurance for this? But we'll get to that in a minute. So for this, measuring your range of motion, typically that would be done in an outpatient setting by an occupational therapist in person. So how can people necessarily do this on their own and have it be accurate?
Yeah, so actually right now the goniometer is in beta, so it's not super accurate, but it is, you still can kind of see the motion and still can test it. There's a little bit of variability because people can kind of move their wrist, and it kind of measures the the change in movement at the wrist joint. But yeah, if you do it, it will show you how to set it up, and then it will show you like how much to bring your wrist back. So it is fairly reliable, but it's not super accurate.
Yeah,
So
it gives like an estimate.
yes, yeah.
Okay.
Mm-hmm.
And then I really like here too how, like, you have your little profile, and then you have a chat box. So there's, people can work with you, Hannah, or another occupational therapist. And I think before you said that you set people up with other therapists. What do you mean by that?
So right now we have 2 therapists. Okay. Prior we were like giving it to other occupational therapists, so like other patients in the clinic that they could give it to their patients. Okay. We're not really doing that so much anymore, but that is still a possibility. Like if you had finished your OT, your outpatient, and then your therapist was like, hey, since I can't see you in the clinic anymore, why don't you switch to this Reactiv program? So there is still kind of that possibility, but that's it. Yeah, if you were like,
you guys are still building a lot of things, but you're
things
had a good start. Yeah.
And
so here in the chat box, like, we can contact you with any questions. I know I had asked you about this KT tape, and you sent me the link to it to go get it on Amazon. So I really like that, because even in the outpatient setting, a lot of times it can be difficult to connect with the therapist afterwards. Sometimes, not all the time. I know for me, my therapist was working in the hospital setting, so I was able to message her on that portal with any questions. But at the end of the day, they're also busy, so they don't get back to you sometimes like the same second or the next day. You're pretty fast in response. So I really like that. And then sometimes even in the hospital setting, if there's like an orthopedic surgeon or someone who's really busy, they may not get back to you right away, and then you have to call the nurse, they'll get back to you. So there's a lot of, sometimes waiting to get answers after the fact, because like you said, sometimes you may forget to ask something, or even like forget how to do something. And then, so it's really nice that you guys also have this communication here for people who want to try this out.
Yeah, I think that's honestly one of the best features, and something that like I as a therapist didn't think originally was going to be like that valuable, but I've really seen like such a great benefit in it. And for the reasons you mentioned, one, it's also on my phone, so I can answer it when I'm, throughout the day, or even like at nights, weekends, when I'm like just sitting on the couch or whatever. Like it's very easy for me to answer it, and that's part of the reason why it's easy for me to be like responsive. Some cases I do have to like look things up, or like, actually make sure, like, find the links if I don't have them already like saved or whatever. But in general, like it's pretty easy to be responsive. And I found that patients like really appreciate that, because that's something that they don't get in, like I said, like with their other physicians. Like it's a lot harder to get in contact with a medical professional. And this makes it easy, especially when it's just like a simple question, or a question about the exercises, or sometimes patients will have difficulty with the games like setup or something, and they'll be like, hey Hannah, like I'm struggling getting the just say like the bubble shooter game to recognize my hand. And so I do one of 2 things: either like type them some tips real quick, just like about the positioning setup, or we can just schedule a call like right then and there, do a quick call, and then on the call we can do a screen share feature, and that way I can actually watch them play the games. So that way I can see like, hey, no, like you need to move up or move back from the camera, you need to put your phone here. You're also like hiking or elevating at the shoulder, so we need to make sure your hand placement's correct. And that's good, because then the patient kind of can see what they're doing right, what they're doing wrong, and then I can also kind of be confirmed that they're doing it the right way, so they're not like doing some crazy thing. It doesn't necessarily work that way, but you always want to make sure that people are doing it right and they're not
and that's what they do in the outpatient setting too.
Right.
Many people watching have experienced that, where the therapist wants to know if you're doing it correctly before they discharge you. And I wanted to say also, with the games, before you start them, they also allow you to practice in the beginning. It's like a little onboarding like thing where they say, hey, test this out, put your hand in the right position, right? Is that kind of what you want to explain a little bit about what happens before you even start the game?
Yeah, so when you go into the games initially, we have a little tutorial, and it just kind of guides you through it. And it will say like, okay, first put your phone about an arm's length away, leaning up against something. So a good place to lean it up is usually like your laptop or a mug or something that's stable. Then you want to make sure you're sitting about that far apart or that arm's length apart. You're sitting in a good supportive surface. And then you can it will show you, the cool thing is that it shows you like an outline of your hands. I'm sure we could show a video of this. It has like a ghost hand. So then you can kind of see how far or how close your hand needs to be. And then it will walk you through the game. So some of the games too, like take a little bit to get to understand like the game mechanics, the rules, but then kind of once you understand it, it clicks fairly easily. But the first game that we have is like similar to Candy Crush. So if any of you guys have ever played Candy Crush, it's the same type of game mechanics, besides you use your wrist in flexion, extension, and radial and ulnar deviation to move those pieces, as opposed to like, when you're playing on your phone or your iPad or whatever, you're like actually physically tapping on the screen and swiping the candies. This is like all controlled by your hand movement.
Yeah, this is better for your hand probably than the regular Candy Crush game, which probably would cause you hand strain and eye strain and a bunch of other annoyances.
Yeah, totally. Yeah, the hands playing on an iPad or a phone, especially like a tap and stuff, it can cause, I've seen actually a number of patients who have, not necessarily from Candy Match, but like just in general, like have pain in their hands and their fingers from like playing on their phone too much.
Yeah. And so when it comes to insurance coverage, I know you had mentioned in our private talks where that you don't necessarily need to have insurance coverage, that you guys are looking into maybe employers covering the cost. Like, how is that all playing out?
Yeah. So kind of things are changing a little bit on that front, but so we're still getting patients like coming directly to consumers, so patients can just come in the app if they see it on social media, if they hear it through word of mouth, and so right now we're just kind of getting patients in that way, and that's right now it's going to be provided at no cost, but eventually we're going to work with the health plans to get it through insurance. But
okay,
as of now, right now we're just trying to get some people in to go through the program.
How long would you think this is going to be like free for people to use? And then also, if people who have kind of enrolled in this while it was free, like how does that all work out?
Like no one is going to be like surprised. Like it's not like one day we're just going to be like, okay, you owe us $20, or like you owe us $100 or whatever the amount is. So the people who do come in where it's free, they would have like full transparency that we would charge before they would like incur any cost. So that's definitely not something to like shy away from, or if you're afraid that like you're going to get a large bill, that's not going to be the case. Yeah. But we may also work on like a subscription based model. So like you would come in, you'd pay X amount of dollars a month, and then you have all the access. But like I said, those are kind of in the works right now. So if that does change after a patient is already in the app, they would have full transparency of like the cost, and then they could either decide to like stay in or drop off. Like we're not going to just be like, here you go, you owe us X amount of dollars. So if people want in, now's a good time to get in.
All right. Well, Hannah, is there anything else you want to share with people here about this that they may need to know about, or any last thoughts?
Yeah, I guess I would just say, like, if you are thinking about trying it or you think you want to try it, like you should try it, because like I said, like I'm one of the therapists that have been treating on it, and I've seen like a lot of benefit for patients. And I wouldn't just say that if I was just like, like shouldn't do it. But I really think that like patients need support. And I really think that like this is a really good way to get support, get questions answered. And it's all from your phone. So it's convenient. You don't have to wait in line to go to the doctor's office. You don't have to wait on hold on the phone to schedule the call. And so it's all just like on your phone. We were on our phone all the time anyway. So like you may as well use it for your exercises, use it to get better, use it to feel better. If you're on the fence about trying it, I think you should try it anyway, because I really think that there's been a lot of great success and there's really a lot of opportunities to help people that otherwise maybe wouldn't have gotten help.
Yeah, and I'm proud of myself for trying it because I was so hesitant in the beginning. I'm like, I don't know if I should have been referred to do this because of my damage. And like, I was just kind of in that phase of like not thinking I could do it. And I know there's a lot of people out there who may have joint damage or pain, inflammation, and they're not feeling motivated, or they just don't feel like they could do something like this. And I'm going to tell you, if I can do it, you guys can play the game too. And so even like, like I had mentioned, Hannah told me about this KT tape, and I got it today here. So she's going to show me later, like how to use this. And that's a great thing too. So you don't only just mention like what we are asking for, but you show us too how to implement and use it, because sometimes people don't know how to use all this stuff. I know it's been a while for me, so it will be nice to see what you have to say about it and how to maneuver in using it, because I've always had like a physical therapist put it on me. I've never really tried putting this specific thing on my own body ever. And I think it's about time I try so.
Yeah. And another point that I will say too is like, if the games aren't appropriate for you, which may be the case, like some people, they might just not be appropriate for them or the condition, but you still have access to the chat. There's still like live telehealth sessions that you can ask questions about. So there's still value, even if you aren't appropriate for the games. So, but yeah, like the things you mentioned, like the K-tape, or just like recommendations of how to kind of use adaptive equipment, or just like an alternative handle, or like just some sort of device that may make your life easier that maybe you don't know about.
Yeah, and I really like how you guys can modify the games for people, because I know when I was doing the bubble shooter game, it was kind of hard to not make a full fist, but extend my hand fully out and separate my fingers, because I have boutonniere deformities on two of my fingers, and my pinky and my ring finger. So it was hard to extend that. But knowing that we can like just make a little fist and, do it like that, it makes the game even that much more easier and just interactive for anyone who wants to just try a little bit of movement in their, hands. And I really like how you guys are also trying to make it for other body parts too. I think that's amazing. So we'll have to keep a lookout for that.
Yeah. So in order to get signed up for the app, you can check out our website. It's www.reactivrehab.com. And then you'll click like the get started, and that will take you to the either the Android store, the Google Play Store, or the App Store for iPhone or iOS. And then you can just follow those links directly to download the app. You can also search Reactiv, and that's REACTIV, in either of those stores, so the Google Play or the App Store, and then you can find it that way. And then, you can also follow us on Instagram, which is at Reactiv Rehab. We post a lot of like good tips. We post a lot about just like some of the stuff that we're doing kind of behind the scenes. And then, it's just like a good resource. And then you can also connect with either myself or Crystal, who's one of the other OTs, directly on Instagram by just like sending us a message or a DM.
Yeah, and you guys are fully trained occupational therapists, which makes it a lot more credible too, because there's a lot of people out there who are giving tips and, they don't have that medical background. So a lot of people are kind of, iffy about what they are sharing, but you guys are actually trained medical professionals in what you guys are doing. So I know even on Instagram, you shared a really cool tip that I have never even known of. And it's like your prescription pill bottles, you can flip it over. I didn't know that.
Yeah,
So,
yeah. I'll just show it right here because
okay,
I have it in front of me. Yeah. So if you take a prescription bottle, most of them, I've heard it's different in different states or different pharmacies, but it might not be the exact same. But like, so this is how they typically come, with the like thicker side on the bottom, which is pretty hard to get open, even like for myself, and I don't have any hand deficits. But then I would say all the ones I've run into, they can flip, and then this makes it really just a pull off. So that's all. Some of them, when you flip them, there's still a twist, but it's not as like tight of a twist because there's no child lock, and then it just becomes pull off. Which you can either like ask your pharmacy to just change the top for you, like if you actually have a lot of trouble like doing that yourself, or you can just once you flip it, just keep it that way. Obviously, then it's not childproof, so if you have kids around, that's not going to be a great option for you or solution. But yeah, it's good to know. I actually posted that, and a lot of people responded that they hadn't heard of that before. So yeah, that's just like one of many tips that we share on Instagram, and things that I've learned treating patients and just kind of over the course of my career. So I'll show you on the hand just because it's easier for me to show you on your hand. I can't really demonstrate on my own shoulder. So, okay. So first you cut a strip. Let's call it 4. Okay. You see how on the back of the tape, there's like these big, thicker lines?
Yeah.
So you're going to do 4 of those boxes. So it'd be 1, 2, 3, 4, and then cut it. I'll just do it. And so before you put it on, I'll show you now for just like demonstration purposes. But before you actually put it on, it's really good to just wipe the skin. If you have like a rubbing alcohol wipe or, what's it called? Rubbing alcohol or
or just like prep pad.
Yeah, alcohol prep pad. I'm like, yeah, you can put it on the skin, and that just helps take away some of the oil on your skin, especially since it's going on your hand. Like a lot of times, there's just oil residue on there, and so that would just help it stick for a longer period of time. Okay, so then you'll have this. So it's 4 long, and then what you'll do is you'll cut it kind of like, I like to describe it as a crayon top because I don't know what shape it is otherwise.
Yeah.
And I feel like that people understand what I'm talking about when I say it. And then the other side, which is just a square, you're just going to round the edges. And this just helps it stick down because otherwise the hard edge will just kind of peel up. So then you just kind of cut it off a little bit so it's a little bit rounded. That's all. And then take off my one. So then you have this, and then you'll tear. So kind of at the bottom of what would be like the tip of the crayon, you'll tear across on the paper. This is a little bit hard to kind of get the hang of doing. So it will show like that. So I just tore the paper, but the tape is still intact. And then you do the same thing on the other end, about 2 to 3 of these squares above it. So then you have these like 3 segments. And then you'll take off just the tip. And then that goes directly on your thumb. So the position you'll start is kind of just like, let me see if I can do this. So you're kind of in this just like relaxed position. You'll put it actually all the way up at your fingertip. So see how mine is like covering my nail. And then you'll just really kind of rub down that top part so the other 2 pieces are still on. And then you'll flip it over and you'll take off this middle part. Oops. And then you'll just take this. So I'm still holding onto this tab. That's why you make those tabs. So it's easy to hold on. Pull it. So we say about 50% pull. So not as tight as it can go, but tight. And then you'll just place it on the skin. And then when you do that, you kind of go up the middle and then around the edges
And place it on you.
and place it on. And then you'll rub. That friction helps create heat, and that helps it adheres. And then you take this and you just place it down.
Oh, okay.
So then that way, peel that off, place it down. And then you just rub it because you want it to stick in that, like I said, that heat just creates, or that friction creates a little bit of heat, which helps.
And you can put this, like you can take a shower with this on, right? Yeah, I know that. And then how long can you keep it on for, you say?
You can keep it on. Some people say up to 5 days. When it's on your hand, it doesn't last that long. It usually lasts like 1 to 2 days, I would say, just because obviously you're moving your hand more, and like especially now in today's age, where like using hand sanitizer and washing our hands all the time.
I've never used it on my hand. That's why I was asking how long it lasts.
So usually like on the shoulder or back, it lasts up to that like 3 to 5 days.
Yeah, that's what I noticed.
Yeah, I find about like a day and a half.
Cool.
And then depending on how that is, if you feel like you still want another level of support, you can take another piece. This is just the paper, but I'm just and then put it right here, and that just gives it like another little layer of support. And you would do that the same way. You would just take it around the edges, and then you just put that on like this way. I can also send you a video of myself doing this.
So thank you, Hannah, for being on today and sharing a little bit about what you're doing.
Yeah, thanks for having me.
Thanks. Bye.